Hi, I'm Dr. Carl Ingber with After Hours Pediatrics Urgent Care. Asthma is an inflammatory condition of the small airways of the lung. Unfortunately, asthma as a word doesn't tell us much about what asthma is. So when we talk about asthma, we talk about reactive airway disease and reversible airway disease. Reactive airway disease means that the lungs are responding to something in their environment, perhaps cigarette smoke, pollens, dust, etc. Even cold weather will trigger an asthma attack. Reversible airway disease, and these are the phrases we use instead of asthma because asthma doesn't tell us too much about what the condition actually is. In reversible airway disease, we're able to give a medication that reverses the narrowing of the effect of these offending pollens. To think about the effect of asthma in the narrowing of the airways, think about inspiration and expiration. Inspiration, the process of breathing air in, is the way we get oxygen into our lungs. Expiration, breathing air out, is the way we expel carbon dioxide gases. In asthma, because the airways are narrowed, you're unable to breathe out the air as rapidly as you'd like, and it actually takes a longer time to get rid of that air. So expiration in asthma is prolonged. As an example, that whistling and a long period of breathing is expiration in asthma that is prolonged. That's a telltale sign that you have narrowed airways. Treating asthma requires two types of medication to reverse the narrowing of the airway. The first type of medication, albuterol, is a medication that's considered a rescue medication. Why rescue? Because when you give the medication during an attack, you are saved from the ill effect of the attack. The other product, anti-inflammatories, are preventative products. They must be given at least 1 to 2 weeks before in order to work. What we do in our office is give a treatment with albuterol, and very frequently the airway passages enlarge, the breathing pattern becomes more normal, and a child's able to get their oxygen in without having to breathe as rapidly as they were before the treatment. After an asthma attack, oral anti-inflammatories, those that are given by mouth, are frequently used to bring the anti-inflammatory level up to a higher level so the child will get over the illness more quickly. Despite the benefit of the rescue medicine albuterol, it can be used inappropriately. Self-medicating teenagers might use the medication to excess, causing serious side effects. Parents should understand that although the albuterol does give temporary relief to the asthma symptoms, excessive use can be dangerous. Remember, asthma is an inflammatory condition, and you need an anti-inflammatory if you're using albuterol to clear an episode. Think about this. If your doctor said use albuterol for an episode, use it. If your child gets better, great. If you need to use it again in an hour, do that as well. If you need to use it again another hour, it's time to see a doctor.